Hey everyone, yours truly, Nightmare Pierre. Welcome to another episode of Real Physician Reacts. And tonight we are having a take two, right? So for those who may not be familiar with the series, this is my series where I either talk about something that kind of comes across my timeline, or I highlight someone spreading misinformation, disinformation, and try to show them, the why their ways are incorrect, right? So tonight we have a repeat guest, which is surprising. I haven't had to do too many repeat guests because usually once we call them out and the information is out there, it's very obvious that they're lying or grifting us, right? Because that's what they're good for the grift. And we have a repeat guest, Dr. Mary Bowden. I apologize if I'm pronouncing your name incorrectly. This is a person who I talked about probably a year or so ago because she was actually suspended from her hospital for spreading anti-COVID-19 vaccine lies, right? She was literally said, nah, you can't work here because you're just flat out lying. Not like educating and saying, hey, there's one way or the other. Just flat out lying to her patients, and then obviously doing it online, and that's enough for them, for the hospitals, because they don't want to be liable with your lying. Hospitals will protect themselves. They say get up out of here. So to like, looks like, in fact, let's see if I can see what day this was, right? So it looks like about 2 days ago, right? About 2 days ago, she posted this tweet. In fact, let me hide myself so you guys can read a little bit. If I had vaccinated 6,000 patients treated for COVID-19, I would have made $1.5 million. And then she shows this COVID-19 vaccine provider center program from Anthem Medicaid. First of all, if you actually Google COVID-19 vaccine center program, this file actually pulls up, right? It's literally the first thing that pulls up. So already we got to pump our brakes. Already we got to say like, okay, why is this the first thing that pulls up? And why did you just randomly post it on a Tuesday? Like what was the reason, right? Again, it was for lies. So she makes this point to say, if I would have vaccinated 16,000 people, I would have made $1.5 million. And of course, I'm looking at the comments. The comments are in uproar. The comments are like, oh my God, I can't believe this. Oh, look at this. They were begging to give us the vaccine for those who, obviously it's been a couple years, but they've been, there's a lot of people who still think that this vaccine was this government plot to get us all injected with, a substance. I don't know what they think is going to happen. We're still waiting for the results. But she was a big proponent of trying to spread false lies associated with said vaccine. So of course, again, when a grifter has to grift, they have to make sure they keep the same energy. So 2 years ago, when the pandemic was running rampant and then COVID vaccines came out, you had these grifters everywhere screaming about the ill effects of the vaccine, like trying to find this red herring or this secret research that no one knew about. That's what they did. They made a lot of money doing it. They had a lot of social media fame doing it, even on this app right here. So when you have a person like this person here, first of all, she posts this, right? So I want to make sure, I want to get people to get clear. She posting this vaccine incentive program isn't out the wazoo, right? Like, it's not crazy to think that your insurance companies will pay their doctors extra if they meet core measurements. Now, of course, obviously, she wants to highlight COVID-19 because it's sexy to highlight COVID-19. But I can assure you, the flu shot has the same incentive type program. The pneumonia shot has the same incentive type program. If I keep my patient's blood pressure under control, guess what? Same type of program. So this isn't a gotcha moment like, oh my God, look at that. Like, they were paying these doctors to give vaccines. No, like, they are paying these doctors to keep you healthy. And you're trying to figure out, like, why would they do that? It's because they know, right? Insurance companies, right? The ones who have to pay the bucks, they know that it is much cheaper for you to be healthy than for you to end up in the hospital. They understand that. They're not, these insurance companies, the Blue Crosses, the Humanas of the world, they're not dumb. They understand that it is much cheaper to keep you healthy than you end up in a hospital sick, right? Because you weren't doing the preventative thing. So what do they typically do for our outpatient doctors? And I know a lot of ambulatory physicians understand what's going on. is that they will give you incentive and what we call core measures. And mind you, the hospital doctors have the same type of core measures. Rehab doctors, same type of core measures. Like they will give you core measures to say, hey, you know what? If you have a significant amount of your patients' blood pressure controlled, guess what? Like we're going to give you some extra money. If you have your patient's cholesterol controlled, we're going to give you some more money. If you have your diabetes under control with your patients, we're going to give you more money. Also, if you vaccinate your patients, again, I want you to incentivize program. If you vaccinate your patients at a great rate, guess what? We are going to give you more money because we already understand the downwind effects of that. We already understand that if you don't get vaccinated with the flu, if you don't get vaccinated with pneumonia, if you don't get vaccinated with COVID-19, we know that the risk of ending up being hospitalized and AKA costing us, right? Anthem, Humana, who are some others? Anthem, Humana, Athena, Aetna, Cigna, whatever these insurance companies are, we already understand that they are going to save money if they can take care of you. But I have this anti-vaxxer here, right? Dr. Bowden, right? Who we are fully aware of, an anti-vaxxer and a proponent of misinformation, drops a tweet making it seem like, oh my God, this is some great let me show you this gotcha moment. Oh, I see your question, guys. I'm gonna get to them. This is some gotcha moment. And like, hey, by the way, like, look how much they were incentivizing people to give the COVID-19. Yes, they were incentivizing people to try to stay healthy, right? They're incentivizing you to do all of these things here, right? So, and this is, again, and what I hate about misinformation is that they only need to give you a nugget of truth and 95% lies, and everyone will run onto it like it's a fool. Like everyone will run like, oh my God, yes, I knew it. Like I knew it. This is it. Right. So I'm looking at her comments, right? Let me see if I can see some of her comments here. Fortunately, and shout out to the community notes on Twitter or X, whatever you want to call it, which immediately called it out as being improper, as them saying, first of all, this is old, right? This isn't like some new thing. Two, saying like, they incentivize all vaccines, not just COVID, but yet you're not posting about the other vaccines or other disease courses because you understand that that's not going to get the quote unquote retweets that you want to see. Like they already understand that, right? And again, if you guys just look at some of my comments, you already have people here who are like, oh yeah, like, yeah, this is definitely government plot, right? Like I say, we're going to get to your questions, all right? We're going to get to your questions, right? Because I'm already seeing lies, right? Which typically, again, not shocking, not surprising, because, and I don't blame you guys, right? Because a lot of you guys have been misled for years, right? If I've thought like the sky was green for years, it'd be very difficult for someone to tell me that the sky is blue. It'd be very difficult. So that's what's happening now. A lot of you guys have been fed lies for years. So the act of being fed something different other than the lie that you've been fed is like, nah, get me out of here. I want no parts of it. Again, totally understandable. We've been here before COVID-19. There was misinformation about the flu vaccine. Before that, there's always misinformation, especially when it comes to healthcare. Fortunately, especially after the pandemic, I think especially more after the pandemic, fortunately, we have more and more people like myself and others who got no problem taking the time out, right, and putting out, the flames of an anti-vaxxer and her lies, right? Because again, she is a liar for it, right? So let's go to someone. Let's see if we can see some comments, right? Let's see if we can highlight some comments here that maybe we can, do some. I call it COVID education, which we haven't done in a while. Fortunately, right? Fortunately. Even though, I was reading somewhere that there's a couple of variants, strains that are being dominated in Canada. And, I think a lot of people right now are kind of worried about the bird flu. Something I would definitely kind of keep an eye on per se, but not something I would lose any sleep over. Let's see here. Oh, sorry. So we had someone says, Mike Hawk says it was a government plot, not for control, but for money. So again, right. And it's just one of those things where, again, and I understand why you may feel that way, because when you see essentially the world stop, right? When you see the world stop, not like the United States stop, when you see the world stop, you're like, all right, man, what is going on here, right? Like you got questions. You probably got more questions than you probably got answers when you see the whole world stop because of this disease that feels like came out of nowhere, that's killing people by the millions, like you can't understand it, right? And fortunately, if you're able to watch this, right, especially if you're able to watch this, if you're watching this video now, we are one of the fortunate people who are fortunate enough to make it out of the pandemic, whether you got vaccinated or not. Whether you got vaccinated or not, whether you were protected by secondhand, protection because people around you got vaccinated and you had to, like, whatever the reason was, fortunately, we're here. And I always want to make sure we take the time out and recognize that we're very fortunate to hear, right? But I can understand why someone may feel like this is a government plot. But then I always ask, like, all right, which government? Again, the whole world stopped. That's why we had a pandemic. The whole world stopped. So which government actually benefited from the whole world stopping, and how much money did they make? Like that's that. And then, like, why don't they keep making money? Like, what's the reason for not continuing to make money? Like, if it was a good thing, right, to have the world stop, travel frozen, stock markets crashing, if that was a good thing for somebody in the government, like, why wouldn't they keep on doing it? Is the question I typically ask when I get those types of questions. Let's see here. So someone says, Mike Hawk says, I know you're right. They shouldn't be telling everyone it's the only way to not die from COVID-19. Yeah, see, I like this question, right? Because Mike is saying, like, well, why were we so, quote unquote, pushing, right? Because a lot of people felt we pushed the COVID-19 vaccine. And and again, like I said, it's easy to kind of Monday morning quarterback now. Very easy to Monday morning quarterback now. But I want you to tell you, I want to remind people some of the things we said. Hey, this is what we think you need to do. We need to social distance. We need you to wear your mask, right? We need you to get away from, like, these gatherings. And there was a lot of other things we said do. And said, oh, by the way, there's also this vaccine here that we know will not only give protection to you, but will also give protection to others. That's already been proven. We're not even really having a discussion on if that's true or not. That's been proven so much that we don't even have meaningful discussions on it. But what happens is, and again, if you remember, people were fighting masking. People were fighting social distancing. People were fighting locking down. Right. So every other measure that we said, hey, this is a great way to protect yourself. And more importantly, right, and I stress this, but I think one thing the pandemic helped us see was that for a lot of people, it's about themselves and not for others. So we were saying, hey, there are some people who cannot take this vaccine. They are on medications. They're immunocompromised for whatever reason. They cannot take this vaccine, even though they want to. Hey, take it for them. And people are like, nah. Like, hey, wear a mask for them. People are like, nah. Like, hey, social distance for them. People are like, nope. Like, so there's a lot of other measures that were recommended that people fought every tooth and nail. So no, it wasn't the only thing we said, but we do know that it was the most efficient thing. We know that for a fact. We know for a fact it was the most efficient way to protect yourself and others from spread and a disease progression of the disease. That we 100% know. Again, we're not even, like I said, this live isn't for that, because that's been proven time after time after again. We're not even having that discussion. But like I said, there were other avenues to do it. So when you have something like this here, like with the insurance company saying, hey, you know what? We will incentivize you to also give COVID-19 vaccines. They sent the same thing for the flu shot. They sent the same thing for keeping your patient's blood pressure controlled. They sent the same things for keeping your A1C under 7. And they sent the same things. This was just another added bonus. They say, hey, you know what? We got this new disease, and this new disease is here. So guess what? My providers, we're also going to incentivize you for protecting your patients if you give them the vaccine as well, too. That's all it was, right? It wasn't this conspiracy theory to get every single person vaccinated who could get vaccinated, even though, whatever, right? If it was and it saved lives, I'm sorry. But it was something that just had to be added and updated. I tell people all the time, when we talk about pre-COVID-19 pandemic, when we used to talk about disability and diseases that would put you, that would cause you to be disabled, especially from the government's eyes, and from disability insurance wise and whatnot. It used to be COPD, it used to be heart failure, cancer was another one, severe debility from a orthopedic standpoint. There are some certain diseases, But guess what? We have to add on there now. We have to add COVID as a diagnosis that could cause you to be disabled and have you be eligible for benefits. Now, I can assure you, anyone who is on the disability list and who gets benefits for disability does not want to be there. But if they happen to end up be there, and they happen to be there because of a COVID diagnosis, they want to actually make sure they are covered. But again, I want to stress this, right? Again, this liar here, Dr. Bowden, right, is trying to spread lies and make it seem like, oh my God, look at that. They're now paying doctors to give, the COVID-19 shots, right? Like they're now paying like, oh my God, look, that's so surprising, as if this is something that is like revolutionary. Like this is not a new thing that has occurred. But very, very good. Very good question there. Let's see here. John, this is a random question, but I do like it. Why do DOs not perform OMT anymore? So for those who may not know, right, DO, osteopathic physician, 2 years in our training, our first 2 years of our training, depending on the school, but most schools, first 2 years of our training, we actually have a focus on doing osteopathic manipulation therapeutic treatments. And what typically happens, and I can assure you why, I can tell you why they don't do it anymore. What typically happens is you go into your third and fourth year, especially when you're rounding in a hospital, and a lot of the rotations aren't necessarily set up for you to continue practicing on your skill. And then you go to residency, and then boom, another 3 to 4 years or more, depending on what residency you go to, where you're not practicing on your skill. So very few DOs go through the training and the continued training where they feel comfortable to continue doing OMT. I like doing OMT. It's, but I'm an internist. I did outpatient medicine, so my patients asked for it. But like now I'm doing hospital medicine, so I haven't had to do it for a few years. But like, if you get me a table, I'll be tissue texture changes, tart all the way. But that's usually the reason why that's going out. Victoria said, what is this live about? Yeah, so we are talking about a tweet that came across my timeline from a known anti-vaxxer, Victoria Bowden. Let me cover myself so you can kind of see. If I had vaccinated 6,000 patients from COVID, I would have made $1.5 million. And of course, the inference is saying that, hey, look at the government. The government was paying these doctors to give you guys this disgusting, this unhealthy COVID-19 vaccine. That's her inference. Like especially if you follow her, because she is a known anti-vaxxer, has been suspended from hospitals for her lies, suspended from socials from her lies. So she's known for that. Like this, we know she's a liar. So her inference is that, oh my God, can you believe like how much they were trying to get me to give you guys the COVID-19 vaccine, and I had to fight them off. But like, first of all, like I told people, if they just Googled COVID-19 vaccine provider incentive program, this file is literally the first thing it pulls up. So this isn't some new thing that, in fact, it came from 2021. This is some new thing that that's popped out of the wazoo. And more importantly, the fact that all vaccines, whether it be flu, pneumonia, everything else, has a similar type of program where, hey, if you vaccinate a certain number of your patients, guess what? Right, we'll give you some extra money for it, right? Because our primary care doctors, they don't make the most money, right? So they have to be to get incentivized to do primary care. We have to incentivize you by, hey, we're going to give you AKA more money by doing things such as preventative care, because we know from an insurance standpoint, if I am Aetna, Humana, Cigna, Blue Cross Blue Shield, if I am those, I know that I save a lot more money when the doctors are practicing preventative care versus when they come to see me in the hospital and I'm taking care of them after they've had their stroke. I'm treating them for pneumonia, treating them for COVID-19, asthma exacerbation, heart attack, it's way more money. They had to end up going dialysis. It's way more money if I had to treat them at the far end. So they say, hey, you know what? We will give you money if you treat them in the beginning because we know we're going to save a lot of money, right? So that's the capitalist mindset, right? Because I know a lot of people have this idea about medicine and capitalism. It is a business. Healthcare is a business. I don't know if people realize that. It's a very lucrative business if you're at the top, if you're one of these insurance companies. And for them to make more money, they say, hey, you know what? I got no problem giving you a few pennies to the dollar of what we typically make a quarter, because these companies make like billions a quarter. I got no problem giving you a little bit of pennies here and there if you just make sure your patients are vaccinated with COVID-19, sure, with the flu, with the pneumonia, making sure their blood pressure is controlled, making sure their diabetes is controlled, and a whole bunch of other things that typically go down with that, right? So very good question here. Kellen of course says didn't give any protection period. That's a lie. And again, like I said, we are not here, right, to argue whether the vaccine works. That's like, again, like if you don't think the vaccine works in 2024, you are never going to think the vaccine worked. If you don't think the vaccine protected people at a much significant rate than those who were not vaccinated, again, you are never, ever going to think that. And in 2024, what I always implore my healthcare content creators, we don't argue facts that are so well proven that it doesn't make no sense to argue them. We don't do that. So again, if you don't think that, the COVID-19 vaccine gave any protection, there's really nothing we can do for you from that standpoint there. I like this question from Jen. Jen says, now the CDC says you can go back to work after 24 hours and there are no mask mandates. This is great. I love this question, right? Because it's a multi-layered question. Right. So let's talk about it. Right. So one, let's work backwards. Let's talk about the mask mandates. We got rid of those mask mandates long time ago. Right. Long time ago, those mask mandates. One, people weren't compliant with it. Right. People were arguing with it. People were in the streets protesting about it. Right. Because they didn't want to have to wear a mask because, someone else who, is immunocompromised or can't be protected with the vaccines couldn't take it. They didn't want to wear a mask for them. So they're like, no, they were calling it a constitutional right not to wear a mask, right? So the CDC said, hey, you're not going to wear a mask? Cool, don't wear it, right? Unless you work in healthcare settings and everything else, because we still wear masks, especially if we get if our COVID numbers rise, healthcare settings automatically have to wear a mask. So that's not every place. Maybe like a Burger King or your Publixes of the world don't have to wear a mask, but you're in a healthcare setting and COVID cases rise, you're wearing a mask. Number two, the fact that the CDC says you can return to work after 24 hours. So if we remember again, and we're going back. It's a couple years ago where before the CDC says, hey, you know what? You got to be out for like 10 days. You got to have a negative test result. Because remember, I remember that because we've had discussions on these lives before about it. Like over time, guess what happened over time? Right? Guess what was introduced over time that allowed the CDC to say, hey, you know what? Maybe you don't have to go 10 days, right? Maybe you can do 5 days. And if you're asymptomatic, you can go back to work. You know what? Maybe 24 hours. Like, what do you think was introduced, right? Again, let me the answer, right? What do you think was introduced that allowed the CDC to say, hey, you know what? We have better remedies, better treatment options, right? Better protections against this COVID-19. So we feel that, guess what? We can be a little bit more lenient on some of the occupational restrictions associated with it. What do you, again, like, y'all can say it in the comments, right? Yes. So, and that's one of the catch-22s, right? You'll have people who will argue against the vaccine. They'll argue to the death of it, right? But then we'll say, oh, look at that. Look at the CDC suddenly changing their mind on old restrictions. Guess why they can do that? They can do that because guess what? Not only do we have vaccines to protect you now, but we also have oral medications to give you, especially when you have a mild disease. So we have more treatment options. It would make sense, guys. Like, think about it. It would make sense when I don't have very much treatment options. I need to be as restrictive as possible to try to prevent the spread. That just makes sense, doesn't it? Like, I can say it in the comments, right? It makes sense if I have less treatment options that I need to be a little bit more restrictive to try to protect you, the patient, and then everyone else around you, because we know how COVID-19 spreads. But as our treatment options improve, we can say, hey, you know what? We can be a little bit more lax because we have some treatment options there. And I think that's that part right there, what a lot of the anti-vaxxers that follow me or, just end up on my lives, like, always seem to miss. Like, there's a reason why we have less restrictions now. There's a reason why less people die now. There's a reason why we have less hospitalizations now. There's reasons for it. Like, but the problem is because you won't give, the boogeyman the credit for it, like you spin your wheels trying to figure out and loop a different way of trying to explain why all these restrictions. come to play. And then you say something like, oh, well, the reason why the restrictions are coming into play because they lied about it in the beginning, right? Or they were too harsh about it. Like totally just skipping the boogeyman in the middle that says, hey, you know what? We have more treatment options. We got vaccines. We got boosters. We got all these better ways to protect our, our people, right, in the country. And guess what, right? We know that some of y'all just not complying anyway, so it is what it is. More importantly, to get a COVID-19 test, right, may cost some people. Some people ain't gonna do that. Some people are just gonna kind of like, I'm just gonna mosey on. I'm gonna try to check it through. All of these factors are coming into play when the CDC says, hey, you know what? Let's loosen up these restrictions, right? So shout out to the vaccines. Shout out to those who got vaccinated, those who got boosted, even those who didn't, right? Shout out to them too. They're still here, right? Shout out to all of these people combined that helped get us to the point where we have less restrictions now than we did during the pandemic, which I would hope after 2+ years, we would have less restrictions now. I would just hope that would just make sense for everyone, everything going in that regards. Let's see here. But I do like the question. Someone said we should be telling people masks. Yeah, I agree. Which man said we should be telling people masks. I love masks. Again, I'm so used to masks. I wear the mask everywhere. I wear the mask, and especially at all the facilities I walk in. Where's my mask? Like, I need my mask. And most healthcare facilities, depending on, because I saw a couple people kind of follow it up and say, how come healthcare providers aren't wearing masks? Most healthcare facilities, if they have a low incidence for COVID-19 cases, the local guidelines and the CDC guidelines don't recommend that they get masks, right? So again, and we know how a lot of people feel about their constitutional right. They feel like it's their constitutional right not to wear masks. And again, I remember this, right? I remember seeing the anti-vaxxers storm school board meetings left and right, saying it's their constitutional right not to wear masks. It's their constitutional right, not to social distance. They were storming school board meetings. Like, that's how bad it was getting, like, during the pandemic. Y'all might not remember it, right? Y'all might not remember it. Right? It was a very wild time here. And mind you, those same people don't go back to those school board meetings. Those school board meetings that used to be full with anti-vaxxers yelling at them, they don't see y'all no more, right? And there's still problems in the school that y'all can handle and take care of, but they don't see y'all no more because, we understand, right? It's not hot commodity. You're not going to end up on TV anymore. If you're arguing that, hey, you know what, my student is in a class with 50 other kids, right? Like, that's not going to get you on TV and get you a lot of views anymore, so you don't do it. But that's usually the case with healthcare workers. If you work in a hospital care system where the incidence of COVID-19 cases increases over a certain threshold, the hospital facilities are required to go back to masking. As long as it stays under that threshold, I forget what the threshold is, they don't have to mask, which reason why most people don't mask. But again, I work at the hospital, long-term care center, as well as rehab centers. I mask every single time. Everywhere I go, I'm masking. Right. And again, I'm talking to administrators, I'm talking to nurses, I'm talking to everyone else who's not masking. All I could do, I lead by example, right? But I can't, again, unfortunately, I can't force them to mask. Only the businesses can, unfortunately. Let's see here. Oh, so someone said I got the vaccination bonus. Now, this is let me decline there. Okay. Someone said I got the vaccination bonus. Now, unfortunately, and I let me make sure I stress this out. Unfortunately, I'm in the hospital and in the rehab centers, so I wouldn't qualify for this type of bonus. But best believe, if I was doing outpatient ambulatory medicine and I was already getting paid on the lower rung tier of healthcare workers, and I knew that there was a way to get a bonus for just doing like what I need to be doing, you best believe I'd be there. But if you don't believe me, I always tell people, if you just Google my name, Dr. Barry Pierre, Medicare payments, because that's how you would find out, you can see Big Pharma's payments to me. So if you Google Dr. Barry Pierre, Medicare payments, it's actually public. Like, in fact, whatever doctor you're seeing right now, like, just Google their name and Google Medicare payment. All of that information is free. All that information is free for you to see. And you guys will see that the last time I got any big pharma paycheck, or not even, it wasn't good money. At first, I've never gotten actually paid from Big Pharma. But when you go to a dinner, and I went to a dinner like, I think it was like 5 or 6 years ago. It's been that long. If you go to dinner, when you put your name down as attendance, they have to credit that to you, right? So that you'll see that was the last time I got any money from Big Pharma. Like, people keep swearing that I'm, part of Moderna Mafia, which I am. Shout out to Moderna Mafia. Or, Pfizer. Or people swear. I'm like, no, the people who get paid for doing that, you've seen them on TV. Like Travis Kelce and them, they got paid. They're on commercials nationally. Like, they got paid for promoting COVID-19 vaccines. I ain't get paid. I keep doing this for free because I actually want to make sure that you guys are still around next year to talk about the next cold and flu season. But unfortunately, again, I stress it. Unfortunately, I have not gotten the vaccination bonus. But if you know a way for a hospitalist doctor to get the vaccination bonus, please send them my way. Michelle said people need to mask up when sick. Oh yeah, definitely. It's one of those tough things, especially, and obviously I'll talk about healthcare workers. Healthcare workers, like I think we have a higher sense of responsibility when it comes to things like this. When it comes to vaccinations or masking up, and we have just a higher sense of responsibility than the general public. So am I mad when the general public, a person who may not, they don't work in healthcare, maybe they work for, in an office setting, or maybe they work at like a retail. Am I mad at them when they're not masking? I wish they could mask, but like I don't want them to mask for their protection. But again, if they feel confident enough, maybe they've gotten their boosters, they've gotten the vaccine booster, they've gotten the flu booster, which you can get at the same time, because I always get that question. If they've gotten it, they feel protected enough, and they're not worried about coming into contact someone at home who may, be immunocompromised. What can I do? But I do think healthcare providers should have a higher sense of responsibility when it comes to masking up, especially when they're ill. Because I can assure you that the healthcare providers will definitely still go to work. Like, we don't have to be 100% to go to work, because we just feel like it's an obligation. Like, hey, you know what? I'm going to run into more patients that are sicker than me, and they're going to need me there to either take care of them. So I may have to mask up. I'm not going to be 100%. I'm still going to go and do what I got to do from that standpoint there. Let's see here. Let's see. You're speaking from a utopia version of Hell Speak. That's so funny. Yeah, I got no money. No money, unfortunately. No money. Let's see here. So we got people saying about they have a friend who went blind from the vaccine. So one thing you'll always see from my anti-vaxxer crowd is that there's always a friend. There's always a friend. There's always someone that they knew. There's always someone there that like had the worst complication from the vaccine. The worst, absolute worst. Like, and I'm assuming worst, not including death. Right, like death is obviously the worst, but I'm backtracking it and assuming everything that could happen up until death. The anti-vaxxer folks always know some friend who got afflicted with it, right? I feel bad for them, right? Because it's a tough position to be in, but they always seem to always know someone who's came up with the most afflicted, adverse effect from this vaccine. And then, of course, they're upset because they can't sue the vaccine company because, again, it's a government plot and all these things that are kind of happening here, right? That's usually the issue there going on with our vaccine. Yeah, someone said the viewers are weird. Yeah, no, it's very common. Whenever it's so funny, especially if you've been on my lives before. Like, whenever we're talking about anything COVID-19 related, we get these types of comments, right? So it's not a shock. Don't be shocked or surprised. Next week, I'm going to talk about high blood pressure. We're not going to get any of these type of comments, right? Unless they try to blame the high blood pressure on the vaccine. I don't know. Like, they'll figure out a way. But these comments usually only occur when we are talking about COVID-19 vaccine, right? Because this is what they do. This is what they do. They type a waste. They type the most, heinous adverse effects that could happen to a vaccine for sure happened because someone took COVID-19. For sure. right? And again, just to recap, we're talking about this liar, Dr. Bowden, who tried to insinuate that, like, oh my God, can you believe that the government would have paid me $1.5 million? Again, I highlight that $1.5 million if I had vaccinated 6,000 patients. Again, Dr. Bowden is a known anti-vaxxer, known spreader of lies. She's been, suspended, kicked off of hospital privileges for her lies, kicked off of socials for her lies. So we just know this is just one of these things where she's just trying to ruffle feathers, right? Let's see here. Someone called me Dr. Dudley. Too funny. Well, let's see. Oh, someone says I'm getting big pharma. If the insurance company is giving you kickbacks. Yeah. I wish. Trust me. I always stress, if you know a way for me to get trust me, if I was sponsored by Pfizer or Moderna, Novartis, if I was sponsored by I'd have a big logo around here somewhere. I would not hide it from y'all. Why would I hide it? What I need to hide it for? I would not hide it from y'all if I were getting sponsored. But unfortunately, which sounds wild, I'm actually doing this for free. I'm actually doing it because I want to make sure you guys are getting accurate information. And I don't want to, because what typically happens, unfortunately, with, a post like this, all of the anti-vaxxers spread it. And it's like clockwork, right? Because I watch it on social. They all spread it, right? And then they all spread it like it's this gospel news. Like, oh my God, look at this. Did you see what Dr. Bowden posted? Did you see Dr. So-and-so posted? It's always this gotcha news. And typically what happens is most of us will kind of ignore it until we start seeing it kind of bubble up over until maybe our friends, our family start asking for it. And then we have to kind of stomp it down. So that's what was kind of happening. Someone asked me, oh my God, were they really paying y'all all that for just to vaccinate for COVID? And I knew why they were asking. I was like, okay, let me make sure I go talk about that, because that's too wild for me. Someone says Pfizer saved my life. People don't know who just you are. Or you do, you don't. Yeah, that's that thing. At this point, if you think that the COVID vaccine was this evil government plot, we can't help you. You're gone. You're already far gone. If you think that all of the doctors and everyone and the scientists who promoting the vaccine, I saw a couple of Fauci comments on there. If you think we're all in cahoots in the year 2024, we can't help you. You know what? All right, cool. Watch this. We were in cahoots. Now what? This is what I always tell my anti-vaxxers. Let's give the scenario that we were all in cahoots, right, to get all of you guys the vaccine. What was our end goal? Right? Maybe it was so we could make the 1.5 million. What was the end goal for it? Right? And it's usually and that's where you stump them, because they usually have no follow-up after that. Right? So that's what I always say, trust me, it's, again, if in 2024 you still think that the vaccine wasn't beneficial, that the vaccine doesn't have protective benefits, if you still don't understand that the vaccine is the reason why our variants are becoming weaker and weaker, that less people are dying from it, less people are being hospitalized, if you still don't understand that, there's nothing we can do to help you. We're still going to do what we have to do, but we're not going to. We just don't fight. We're just not going to fight over that, because we know better. We just, it is what it is. We know better. Let's see here. I want to make sure we don't miss any too. No, what you about says, I gotta talk to my peers. No, it is. Especially because I don't go to the acute care center hospitals very often. I'm more in the rehabs and long-term care centers. And again, I'm always shocked when they're just running around with no mask. I'm like, oh my God, no mask. Y'all wild to me. Y'all are very wild to me, because I can't do it. I just, because I remember pre-COVID, I remember during COVID, pandemic height, I remember all of that. So I remember how fearful and scared everyone was when these things were happening. So, and again, I got kids, I got a wife, I got mom. I'm not trying to, bring one of these diseases to them, right? And I'm gonna be the reason why they got it. It just, unfortunately, is what it is. Someone says I'm still pushing the agenda, the propaganda. That's too funny. Let's see here. Someone says the vaccine will not prevent transmission. Yes, it will. And again, I want to say prevent, right? Because a lot of people hear that word prevent word and they feel it has to be 100%. It's reduce. The vaccine will 100% reduce your risk of transmission, 100% reduce the risk of progression. That's already proven. We're not even having discussions on that, right? And the reason why, again, like they said, the 50% of cases are asymptomatic. The reason, guess why? Like, again, I always ask the why. One of the things my attendings used to tell me, Barry, always think about the why. Why? Why is it that we have cases that are asymptomatic? What is it about the people who are asymptomatic cases with COVID-19? What's happening, right? And again, if you understand, again, like I said, I got videos for like 2+3 years ago that explains it. But again, in short and sweet, guess what happens when, let's say, let's rewind, height of the pandemic, right? Just for a quick lesson, because we're going long, so we're about to get out of here pretty soon. If you get vaccinated, let's say you got vaccinated, right? And now guess what? I decrease the risk of you getting COVID from me. Let's say I'm vaccinated, but I happen to pick up COVID one way or the other. Guess what? And then let's say COVID has to reach a level of 10 before it spreads to the next person. But because I'm vaccinated, it only reaches that level of 7. It only gets to 7. It's there. It's not 10. Still may cause me some symptoms, but not enough to get everyone sick. And then you happen to pick it up, and there's some genetic protections you may have, or that COVID doesn't get to that level of 10. Guess what? You're not going to be symptomatic from it. Doesn't mean that the reason why nothing happened to you is because you happen to not be vaccinated. That's just untrue. Just untrue. You're right. But again, like I said, we're not having discussion on efficacy of this vaccine because the vaccine efficacy has been proven over. Like, what's worse, the one thing that's been proven over and over again to not work, right, was that horse pill that everyone was taking at one point, ivermectin. Like, the amount of studies, which is surprising that they keep spending money on these studies, the amount of studies that went to ivermectin to show, yep, ivermectin doesn't work there, ivermectin doesn't work here. Ivermectin, like the amount of studies that show that versus the vaccine studies that say, yep, out the park, knock it out the park, like, let's do this, like, it's just mind-boggling. But again, I understand, like I said, if in the year 2024, you still don't think that the COVID vaccine had protection, like, you're never going to think that. Like, there's not a new study, right? Because you can just read the old studies. There's not a new study that's going to show you your way of saying, like, oh, you know what, maybe the vaccine is the reason why, you know what, we're not in lockdown, is the reason why we don't have social distancing anymore, is the reason why, people aren't wearing their masks. Like, I'm not going to attribute that. Let's say for some reason you do not want to attribute that to the vaccine. You just have to come up with your own conclusion of why that is, right? And again, I can't come to that conclusion for you. I can just kind of give you, hey, this is the evidence that we got going on here. This is all I can do. This is the evidence that we got going on here for you, right? So again, I'm about to hop off, y'all, right? Like I said, we had a great live tonight. I see a lot of questions, right? We will get to them. Again, I feel like, I guess we may have to do it because we haven't done one of these COVID ones in a while. And like I said, I wasn't expecting that many people to hop on here, but we got a lot of people hopping on here, which means a lot of people like to talk about COVID or the vaccine or whatever the reason is. So I think we're going to probably hop on maybe tomorrow night. I think tomorrow night we'll do one dedicated to just talking about COVID-19 vaccine and, the lies and the truths that are available. Make sure you like and to follow. If you caught this late, we will be posting this on the YouTube page tomorrow and the podcast on Saturday. So y'all be blessed.